So the next talk is going to be given by Dr. Gelfert from Intervet, who's going to talk on early detection of bovine respiratory disease with flunixin to help reduce use of antibiotics in calves.
Thank you, Mr. Chairman. Dear ladies and gentlemen, the use of antibiotics, especially in food animals, is intensively discussed within Europe, and different monitoring or restriction systems are meanwhile established. In Germany, beef farmers are facing a new index for their use of antibiotics in their farms for their cattle, and a typical German expression, it's a farm-specific biannual therapeutic frequency. What does this mean? Here's a formula how to calculate this frequency. And for example, if you treat all your animals or half of your animals for 5 days with an antibiotic, your therapeutic frequency would be 2.5. Now, this biannual frequency is calculated for all beef farms in Germany, and then the median is calculated, and the farmer has to look at his specific value compared to the median, and if it's above, then he has to become active together with his veterinarian to reduce the use of antibiotics. And if his value is within the 25 highest values, then he has to write a plan and send it to the authorities for approval. So there's now really big discussion what to do to lower the use of antibiotics in beef farm in Germany. And as we all know, the main cause for the use of antibiotics in beef cattle is bovine respiratory disease. And what we also know, the treatment access is decreasing with time. So it's very important to treat the animal in the very early stage of this disease. But what we also know, that is not that easy. The farmer can invest in time to monitor carefully his newly arrived calves to see the small signs of early disease. Or he can measure the body temperature several days from all his newly arrived animals. That's fine. Both methods work, I think. Nevertheless, it's a very time-consuming method if you do this in an open barn like this. And if the farmer does not want to invest in time, he must invest in money. And he can do so. For some years now, tools are developed like this rumen bolus to measure constantly the body temperature. Or nowadays there are ear tags which measure the body temperature in the ear. Okay, so with these tools, it is possible, perhaps easier, to detect the animals in the early stage of bovine respiratory disease. That's fine. Now, considering the pathogenesis of bovine respiratory disease, we may think about that in the first step there is the virus infecting the animal and induce the increase of body temperature. If there's only the virus, then we do not need a treatment with an antibiotic. But what we need is to treat the animals with an NSAID to stop the inflammation induced in the lung to avoid any permanent damages in this organ. So combining all these three facts, we have to lower the use of antibiotics. We have now the possibility to detect the animals in the early stage of bovine respiratory disease, and that there might be only the virus at that time. We set up our hypothesis. The first was, okay, that is possible now with these tools. Let's see what happens if we treat only the animals with an NSAID in the first treatment. And then we thought about, okay, that will probably not reduce the antibiotic use in bovine respiratory disease treatment to 0. But we thought about that we would be able to reduce the use of antibiotics during this kind of treatment by 1/3. And to prove our hypothesis, we set up a study. This was performed on 2 beef farms, typical beef farms in southern Germany. We had 80 newly arrived Simmental calves around 6 weeks of age. And they were clinically examined. Only clinically healthy calves could enter our study. And then this ear tag was fixed in the ear. You see here this long probe. This is inserted in the outer ear. This measures constantly the temperature in the ear. and if the temperature in the ear exceed constantly for 6 hours 39.7 degrees Celsius, then a red light starts flashing, and so the farmer can see, okay, there's an animal with fever. We monitored the calves, the newly arrived calf, for 8 weeks. Each alarm was monitored and randomly assigned to 2 treatment groups. I come to this later. We had calves with repeated alarms, and we decided to count a repeated alarm as a new case of fever period if the time between 2 alarms exceeded 7 days. What's also not to mention, what was worth to mention is that in the first 14 days, the animals received an orally fed antibiotic. That's a typical method in beef farms in Germany. So on day 1, the red light starts flashing. The farmer detected the animal. He controls the body temperature to confirm the fever, and then the calf was randomly assigned to 2 treatment groups. In the study group, the calf was only treated with flunixin, as the shown doses here, as pour on, so this new phenadine transdermal. And in the control group, we combined the NSAID, the flunixin, with florfenicol, so these calves were immediately treated with an antibiotic. On day 2, and this was very important, the veterinarian examined all the treated animals, and he decided whether any additional treatment was necessary in both groups. And if he decided to treat the animal from the study group with an antibiotic, he used or she used florfenicol, so that we had the same NSAID and the same antibiotic in both treatment groups. Then the calves were monitored until day 6, and to close the case, a final clinical examination took place at that day. Now, what happened within the 8 weeks of observation? We had a total of 80 fever alarms. They could be traced back to 53 calves, so 2/3 of all calves developed at least one time fever. We managed to more or less evenly attribute them to the both treatment groups. 70 calves showed more than one fever period, so within at least 7 days time difference. There were no difference between both treatment groups. So even calves immediately treated with an antibiotics also showed fever again after 7, 8, 9, whatever days. So there was no difference. It does not help to treat immediately the calf with an antibiotic to reduce the risk of a relapse or a second fever period again. Okay, let's see now what happens to our calves treated with flunixin only in the first step. We had 43 calves treated that way. And as I said before, the veterinarian then decided on day 2 whether an additional treatment was necessary. And perhaps you remember, we thought, okay, in 1/3 of the cases, he would decide not to do so. And we were very astonished that it was just the other way around. We had in 2/3 of the cases that the veterinarians decided, okay, the treatment with flunixin is sufficient, the fever went down, so no any additional treatment was necessary. And according to the sign test, the 67% is significantly more than what we assumed in our hypothesis. Before I sum up, I want to thank especially both veterinarians who did all the practical work, all the documentation for our study. I thank my colleagues from MSD Animal Health, especially the farmers that we are able to do the study on their farm. And finally, Fevertex LCC, they provided us with this tool. And in conclusion, I can say that our study showed that in case of early detection, we are able to treat the animals in the first step only with an NSAID, and this will help to reduce the general use of antibiotics in case of bovine respiratory disease. The crucial thing within that is the early detection. And as I said before, the farmer can invest in time or in money. Money, I think, in these days is a little bit difficult, yeah, when we consider all the milk price and all the other prices. But I mean, still the farmer can invest in time. The crucial thing then is he must know the clinical signs of this disease. But I think then we as a veterinarian can help him to know, to learn the signs so that he can detect by his own the animals in the early stage of the disease, to treat the animals in the very early stage with a high treatment success and a lesser use of antibiotics. I think that's worth to try. I ask you, what do you think?
Okay, we've time for a few questions. So, if I could start, it looks like the fluorophenical isn't doing anything at all in the study. So did you have a fluorophenical control group?
No, we didn't have, because yeah, that would be also, of course, nice. But on the other way, it is state of the art to treat animals with bovine respiratory disease with an NSAID to stop the inflammation in the lung.
Yeah.
So I think that would be not useful to do this without an NSAID. And on the other hand, we wanted to look whether it is possible to get rid of the antibiotics. So there was no need to have an antibiotic-only group.
But it looks as if the antibiotic is having a very small effect by itself, or when it's combined with the flunixin compared to the flunixin alone.
Our study did not, in the other group, there were no, from the 37 calves treated immediately with fluorophenical and flunixin, we had only 4 calves which need another treatment. Yeah, so, of course, the combination helped. Yeah, there were less additional treatments necessary than in the flunixin group, but 100% were treated with an antibiotic. And in our other group, only 1/3. So the effect was to reduce the use of antibiotics, and that is what we wanted to show.
Okay.
Not the effect of fluorophenical.
Right, but your second set of results was a bit different from the first set. Do you remember you had the bar chart? If you could just maybe go over that again.
Yeah, of course. To the chart. This one?
Yeah, could you maybe just explain that a bit better?
Okay, on day 2, the veterinarian examined the animals. These animals, these 43 cases, were only treated with flunixin as per on. And then the farmer decided whether an additional, especially antibiotic treatment, was necessary, because the calf looks worse, the fever was still there, or any other reason. And in 67%, so that are 29 cases in number, he decided, okay, it's enough. The flunixin worked, and no additional treatment was necessary.
Okay, got it. Question down the back?
Question. If you switch to this monitoring system where you measure temperature alarms, how many additional cases of BRD do you end up recognizing for treatment over basing the first pull rate just on clinical signs? So what is the increase or the decrease in the number of calves you define as sick just because you pull them based on the temperature of the ear?
That's a really good question. And when we did the trial, the farmer, especially one of the farmers, he had the impression that not really each fever case was to treat. But the study design now was, okay, there's fever. If the fever is confirmed, then we do the treatment. But sometimes he said, okay, probably it could be good to perhaps to wait if it's really in continuous fever for more than the 6 hours and then start treatment. So I think sometimes that is probably only, even for 6 hours, a small fever episode which would go down without any treatment. Yeah, and what both veterinarians said, due to this detection system, they found more calves in this early stage of disease. Yes, probably without that they would find the calves in a smaller size of numbers and much later.
Okay.
Kristen Ryer, University of Bristol. Very nice study. Thank you very much for collaborating on a similar one in dairy calves. And just wondering about, can you confirm that the veterinarians were blinded as to which treatment group the animals were in when they were making their clinical observation?
Yeah, of course they must know, because if the calves were initially treated with flunixin, then and they would decide about additional treatment, they would know. They had to know whether already there's an antibiotic in. So this we could not exclude, the blinded decision.
And can you just answer, was there a standardized way of clinical exam, so Wisconsin calf scoring or something like that, was that used at all?
Yeah, we had a score about nasal discharge and all these signs, and he had to score in no, minor, and heavy.
Fantastic, great result, thank you.
Hi, I'm Sophie Mahendran from the Royal Veterinary College. Again, thank you for a great presentation. I was just wondering, how did you actually confirm that these pyrexias were BRD associated?
We can't do that. I mean, it was really a practical clinical trial, and I mean, we could have done this by doing any swabs from the nasal or from the lung, but it was not in the use. This was not the purpose of our study. That is also not what the field veterinarian is doing. If they has a case of fever and signs of bovine respiratory, or it looks like bovine respiratory disease, then he would start to treat. Yeah, and he cannot wait for any results of any laboratory. So what we thought is, okay, there is fever, and let's think about, okay, first reduce the fever. Perhaps that's enough without any antibiotic.
Thank you.
Okay, we're going to have to move on because we're into the next session. So thank you very much.
Thank you.
Okay.